Welcome, everyone. My name is Reggie Barnes. I am introducing the January Autoimmune Registry webinar with our featured presenter, Jenny Pagel-Guile of the National Pancreas Foundation. We had the luxury of having Jenny with her wealth of knowledge over 20 years in the nonprofit sector. Before that, I'd like to introduce our Executive Director, Aaron Eben. Aaron?
Good morning, everyone, or good afternoon if you're on the East Coast like me. Thank you, Reggie. We're very excited to start the year off with the presentation from Jenny. And I just want to talk about what we're focused on this year. We're going to be trying to get more of the, we're trying to build an autoimmune data commons. And that isn't necessarily a place as much as a set of guidelines that we all use in our data collection and data management processes so that our data could be combined by researchers if they wanted to do that. And that's one of the goals of these webinars, is to exchange ideas on how we work with data. The Autoimmune Registry this in December had a paper accepted by the Journal of Clinical Investigation on autoimmune disease prevalence. That project shows, that paper shows 15.5 million people in the United States with autoimmune disease, at least one autoimmune disease. And even though that number is lower than generally believed, that's because we found that a lot of these people had more than one disease. So people were being double counted in previous studies. So fewer people, but sicker than we thought. So that's the kind of research that we like to support. We're going to be following up on that research. We're working with the senior author, Dr. Delisa Fairweather from the Mayo Clinic. We're already working on follow-on studies to that work and look forward to participation from all of you. So with that, I'll hand it back to Reggie.
Fantastic news. We have an exciting year planned for 2025. With that, I'd like to turn it over to Jenny for our presentation. Jenny, it's all yours.
Perfect. Thank you. All right. Can you see my screen all right, Reggie?
Yes, everything looks fantastic.
Perfect. Well, thank you everyone so much for joining us today. And I know this will be on demand later, but excited to share with you a little bit about the National Pancreas Foundation. We work very closely with our medical partners in a variety of areas. So I wanted to share a little bit about those medical partnerships. First, I'll start off with a little bit about the National Pancreas Foundation. For those of you that aren't familiar, our mission is to provide hope for those suffering from pancreatitis, pancreatic cancer through funding cutting-edge research, advocating for new and better therapies, and providing support and education for patients, caregivers, and professionals. So we definitely have a dual approach to our work for the patients and then the professionals in the field as well, serving our pancreatic disease community. What is also unique about the National Pancreas Foundation is we aren't focused on just pancreatic cancer or pancreatitis. We are all encompassing of the pancreas. So acute pancreatitis and chronic pancreatitis, which can be associated with autoimmune disease, pancreatic cancer, pediatric pancreatitis, and FCS. If you're not familiar with the pancreas, it helps with digestion and creates insulin. So there's other comorbidities that go along with that. But some of the things that we see are that it presents differently in all patients, which makes the diagnosis difficult at times. A little bit about pancreatitis. It is an orphan disease, if you will, with lower diagnosis. Also the difficulty in diagnosis. One of the things that we try and overcome is there's a perceived misconception that is often associated with alcohol, but we are finding more and more that it's hereditary, it's a comorbidity to cystic fibrosis, and very much familial in its presentation. So chronic and acute pancreatitis are presenting in different levels, which makes it very hard to diagnose, and why working with so many professionals across the country helps us build a larger pool of folks that can be surveyed, data collection, or clinical trials served. Another piece that we serve, again, is pancreatic cancer. The American Cancer Society just came out with their newest facts in pancreatic cancer as one of the deadliest cancers. the 5-year survival is only 13%, and it's estimated this year that over 67,000 people will be diagnosed with pancreatic cancer. Again, our work is to help with diagnosis, treatment, and care. It's usually not found till later stage, which is why those survival rates are so low. So again, educating our community of the signs to look for. Pediatric pancreatitis is also rare disease, orphan disease with fewer cases, but we are seeing those numbers are going up as we're able to educate providers so they can look for more standard presentations of symptoms, but also getting the misconception that it's not always associated with alcohol. It is very much a genetic disease, if you will, that it's comorbidities of other infections along the way. So education on the pancreatitis stage, and again, pancreatic cancer, trying to raise that survival and earlier detection rate. So how all this feeds into what the National Pancreas Foundation does is we have awarded over 5 million grants during our lifespan of 27 years as an organization. And today I'm going to focus on our centers of excellence. The NPF has created an endorsement in a partnership with centers of excellence that meet certain standards. And currently we have 180 partners across the United States. With those partners and our community volunteers, we've provided over 30 programs for patients and physicians over the past year. So these could be in person, online, or a mix of delivery. This is a condensed version of one of the flyers that we use. So at the top, you'll see a list of our patient programs. Again, if you've never had an incident that's involved your pancreas, you might not even know why you need it. So we have the animated pancreas patient, which are videos that are highly viewed, usually early on in diagnosis. It's an animation. It's very easy to follow along and just learn a little bit more about your disease state. A few of the others we'll talk about more in depth, but I also want to touch on that we are national organization. All of our staff is fully remote, but we rely heavily on volunteers across the country. So we have local chapters in 25 different locations that either do tabling, community education, advocacy, as well as fundraising initiatives. So our grassroots efforts leaders. We also know that, again, if your digestion from your pancreas and lack of insulin, it affects everyone differently, but it really impacts what we can and can't eat and still want to be nutritious. We have 2 disease state cookbooks that are available. So it's a starting point based on your flavor and what your body can handle. You can adapt, but it really is a great resource for folks as they're learning to deal with their diagnosis and their disease state. Again, at the bottom, we have a list of provider programs, and we'll dive into those a little bit more as we go through. But this is a great handout that we provide at our areas, so they can just scan the QR code and go directly to our website. One of the ways that we rely on our centers of excellence doctors, my staff and I are not doctors, nor do we play one on TV. So we rely on our subject matter experts to help us vet, approve, and make sure that the information that we are putting out there is to the patient's needs. Our current board chair is Eileen O'Reilly. She's at Memorial Sloan Kettering, and she is on the oncology side of things. So during her tenure, we'll probably focus a bit more on our pancreatic cancer side, but our board is made up with doctors across the country in various specialties that really help us chart our direction for programs, provide speaking opportunities, and educational pieces for our community. As we dive deeper into how we work with our centers of excellence, we offer the centers of excellence based on your hospital type. So there's pediatrics, there's academic, there's clinical, depending on the type of hospital you're at. And currently, as I mentioned, we have 180 centers of excellence with 93 cancer, 68 pancreatitis, and 19 pediatrics. So we have an assortment of centers of excellence that we partner with across the country. What this does is it provides us to do patient-forward education. It provides resources for the centers of excellence with such an orphan disease. It allows a networking group for our professionals, our medical professionals, whether it be the doctors or the nurse practitioners or the nutritionist. We provide a connection point for them to continue to grow improvements in care and case studies. If you were to come to the NPF website, there's a couple of different pieces. Again, we're the medical side as well as the patient and provider side. For the provider side, there is an option to click through the options that have an application downloadable to become a center of excellence. So there are the criteria that we put forth, which we'll dive into in a moment. And then if you're a community member looking for a center of excellence with a new diagnosis, maybe you've just moved, you can put in your address and the centers of excellence closest to you will pop up and you can meet your needs. Here is a heat map of where our centers are across the country. So we are growing. We do have some spots that still need some centers of excellence, but we're always trying to work with more doctors. Or if there's not a center of excellence, if we know some doctors in the area, or if there's a referral from a local center of excellence, patient care is first and foremost and access to care. So as I mentioned, there is an application for the Center of Excellence. There is the expectation that we are a resource as the MPF for the Center of Excellence, and that the Center of Excellence is a resource for the MPF. So we're working together to move forward the mission of the MPF as well as patient care. There are different items based on a pediatric or cancer. So that's lined out in the application, what kind of specialists you need on staff to have that designation. The other piece that we need to keep the work relationship moving is there a program director or a main point of contact designee. So who, if the MPF needs information or to gather, or if we need a patient referral, or if we're needing a speaker, who should be our main point of contact. The other piece is just information sharing. If you're a center of excellence, we'll share a clinical trial or a webinar or something that you're hosting, a CME online on our website, but we also ask that you make sure that you share the most up-to-date information from the MPF. That flyer that I showed earlier is basic, but we have more information available. So part of it's just getting the best information to our patients. The other piece that we add in here is engagement with our chapters. And the other piece is data collection. It was mentioned earlier how important data collection is, and now we're really sending out specific surveys to our communities as well as our centers of excellence so we can continue to pinpoint different topics of study, areas that we need to focus our programs on, or if we need to create a program to meet a need. So we're definitely interested in data points and trends in the healthcare for pancreatitis and all pancreatic disease. The center application is after 3 years, there is a follow-up and renewal just to make sure that you're still meeting the criteria, because we know staff and hospitals change over time. In addition to the standard Center of Excellence requirements, we do have some requirements for the directors. Again, making sure that they're open and understand there is a responsibility to network and connect with the MPF. Again, the chapter connection and participating in any surveys. We want to make sure they understand that there is a commitment to move the programs forward. And if you're providing information that helps us better refer patients to you, we have a hotline that folks can call. Sometimes if they're newly diagnosed or not sure where to find a specialist, we collect data and share that on our website, and they can talk to Jasmine, who would answer the phone at our end to help point them in the right direction. This past year, excuse me, and being implemented into 2025, we've added a few elements to our Center of Excellence agreement. There is no fee or application monetization for a Center of Excellence, but we do ask that they participate in their community in any fundraising or awareness activities. So we offer a variety of opportunities. We do a pancreas bowling event in collaboration with our chapters. We have marathons, Color It Purple, and in a limited number of cities, we host galas. We just ask that they participate. It helps us fund mission delivery programs, as well as resources for the Centers of Excellence. Excuse me. The other piece is just information sharing. And again, we're trying to get more health and awareness fairs and community awareness. I apologize, it's terrible timing for a cough. In addition to adding those additional pieces to our communication, we have added a few more elements. Excuse me. We offer quarterly Center of Excellence calls. They are open to all Center of Excellence staff. Excuse me. And this allows us to update programs and priorities that are going on for the MPF. If there are any changes that they need to be aware of, and reminding them of key dates. Also, excuse me, there are additional opportunities for staff to provide updates for engagement It's on one of our strategic partner directors. Trish is on the call. She may provide sponsorship opportunities or engagement. Our program teams may do a call for programs if we are needing additional speakers. Another piece that we work with, again, to just streamline communication, is we have a monthly standard Center of Excellence newsletter that hits any topics, upcoming events that's for the center director or the center staff, but I guess they can send it out to any newsletters that they have for their community members as well. We also do custom emails if we have specific requests. For instance, we have a few nutrition webinars coming up we might need a speaker for, or if they have patient recommendations for the panel, we ask them specifically because they are on the ground in the clinic and they don't know who those best representations are of those case studies. And again, always going back to data collection and calls to action. There might be a survey that we need input on. And on all of our webinars that we're putting out, we do provide a survey at the end of each one, just to collect data if they learn something, how they will implement it, and what other program topics they're needing, so we can continue to keep program relevant and meeting our community's needs. One of the things that we also made last year for medical professionals is a medical professional portal. All of our webinars are hosted online on our YouTube channel, and they're open to anyone. However, we have language that's slightly different for a medical professional portal. Those are focused more towards professionals. They could be a CME, so that language and that presentation is going to be slightly different than if we did a modified version for a patient or caregiver. So we do have some targeted pieces, and they become very popular. One of those examples is our Pancreas 101. It was launched early of last year, and there's 3 CME modules. So we work with a company to make sure that we're meeting the time requirements for CMEs. We're making sure we're hitting the topics that are required and relevant. We gather speakers from our centers of excellence across the country. And then there's segmented tests across the board, again, to keep it CME. We've had close to 1,500 people take this. We get data on how long they were in the system, a lot of metrics from it, which is helpful for us to know who's using it and when and how. What we've also gotten direct feedback for is our center directors or nurse coordinators. If they hire a new staff person or a new nurse that's never been in the pancreas field before, they sit them down and have them watch this Pancreas 101 as part of their onboarding and training, because we have doctors, again, that are renowned in the field from across the country, giving different elements and teaching on what the pancreas is, best treatment options, and some 101 within this area. We're looking to build more of these, but again, we're gathering data from our medical side to see what they have an interest in. But this one has been very promising so far. Again, that was the doctor side of things. Now here are some patient education webinars. These topics are very focused, but again, we pulled various doctors, leveraging those relationships. You'll find in the pancreas field, there's not a straight path to being a pancreatologist. We have endocrinologists, we have gastroenterologists, we have a variety of doctors, oncologists that specialize. So within our centers, by them providing input and engaging with us, I know that Dr. Bellin is amazing with diabetes and has a large patient population. We have targeted doctors in Chicago, Kentucky, and Atlanta who are great with our minority population. So they are participating in these webinars. They also, again, give us patient referrals because we want the physician side as well as the patient side during these webinars as much as possible. So what your doctor says you should do, and then how a patient or your cohort or a peer is living with the disease. We have a tentative schedule already planned for 2025. Our doctor's schedules fill up fast, and we want to be consistent with topics on the website, keeping our folks engaged. So you can follow us on our website. We have a more up-to-date calendar that's interactive that you can register as those become available. One of the pieces that we also partner with our centers of excellence with is posting clinical trials. Being an orphan disease, it's sometimes difficult to find a patient population for accurate clinical trials. Some of them are limited to in-person and geography. So for the clinical trials, we again have our patient resource side. What is a clinical trial? Why would you be involved? What applies to you? What questions you should ask? And then again, if you're a center of excellence, we can list your clinical trial on our website for patients to find, or we can post out to our email list if you have a clinical trial available. I have this one here. It's a virtual one. Most of them are in person. So again, getting more patients active into clinical trials that are qualified helps with any FDA approval or movement in the disease state, treatment, and care. One of our targeted programs for the National Pancreas Foundation is the Black African Initiative. With that, a few years ago, we created some online resources. The African American community has higher rates of pancreatitis, as well as higher rates of pancreatic cancer with lower survival rates. So part of it is creating that education, that resource for the community, helping them understand their family history and where they have access to care or support for access to care. This is available online on our website for download. But over the past couple of years, this guide has had over 12,000 views or clicks. We have used this as a resource for tabling events in targeted areas. As I mentioned, we have a large doctor population that's very active for this initiative in Chicago and in Lexington, Kentucky. Tyrone Conwell's the director and been very active. So we have some targeted areas that we're looking to replicate this in other communities. The webinars are online that, again, you can always watch. But this is an example of how we flip being involved as a patient, and this is more of the medical professional, improving representation of minorities in studies of the disease state. So if you are a physician, how can you encourage others? How can you help those patients answer their questions and be involved so we have a broader participation and representation within our case studies so they're more valid for treatments or care as they move forward. Another initiative that we have is our diabetes initiative. Again, if your pancreas is not creating insulin, it's affecting how you digest your food and absorb nutrients. You're not type 1 diabetic, you're not type 2, but one of the comorbidities associated with pancreatitis is type C3 diabetes. It not being officially recognized creates some confusion and frustration for our patient population for billing, coding, and fulfilling those subscriptions. So with this work group, it's our doctors that are endocrinologists. We have some gastros. We have folks on the public health side working together and working with the American Diabetes Association to create a formal listing of type C3 diabetes for glucose monitoring. And again, that ease of insurance. We've seen some progress, but this group is continuing to move forward because there's some more work to do around terminology, a little bit more around diagnosis. So again, this is a behind the scenes element. We're doing diabetes care webinars, but to try and work with our medical partners and other organizations and with government agencies to make their care and access to medications easier as one of the elements of our diabetes initiative. Excuse me. So to get more potential doctors and researchers in the field of the pancreas, we as the NPF have hosted, and this will be our 19th year, an annual fellow symposium. This is where we bring in around 60 up and coming fellows, PhD level, residents who are interested in the field. It's a CME. We put them in a much warmer setting. I'm in the Midwest, so I'm very much looking forward to Orlando in April. But we have about 40 mentors that are leaders in the field of pancreatitis, oncology, that they can mentor and be involved with, and hopefully pique their interest to stay in the field. A lot of our doctors that attend as mentors also participated as fellows. So now they're sending their fellows to this event because they see the value in it. And we're seeing the return. In addition to allowing education with different tracks and a couple of breakout sessions, we also talk to them about how to apply for a government grant, how to set up their lab, how to be successful and really work with that mentor program. So with this, we are connecting the up and coming doctors with more established doctors so they feel that they have someone they can reach out to. Again, it's a very tight-knit professional organization because pancreatic research is not something that's widely done. So we are trying to be a connector for all of these professionals. So as they move forward, they can share research, share data, and continue to move our metrics forward. Another item where we really rely on our doctors to make this program is Camp Hope. Will be its 4th year. If you are a youth with pancreatitis, you often miss a lot of school. You have very limited diet. You spend a lot of time in the hospital, and you're very limited on the school activities that you can do, or activities away from home, or people that know how your treatment goes. We partner with Rebecca's Wish, another pediatric pancreatitis group, and host a summer camp. It's kids just with pancreatitis, often post TPAIT, which is a surgery often associated with pancreatitis. And the numbers that you'll see on here is that we have a lot of volunteers that are adults with pancreatitis. They want to mentor kids with a disease state that they never able to experience somebody like them until they were much older. But where we really bring in our medical staff, as you can see that there are 37 staff that includes RNs, physicians, mental health professionals. Camp Hope is a camp where we bring in a full medical team. So mom and dad feel comfortable. They drop their child off. There's an orientation. They have a full list of their child's medication and all the medications that they need. Their camp counselor is a nurse. So at each meal, the menu is created using the pancreas diet in mind. So there's vegetarian options, gluten-free options, very low fat options. So everyone, we're taking those into consideration. They get all their medicines, but if something were to happen, like they get dehydrated, or if their medication, their enzymes aren't working, or they're not feeling well, we have all these doctors and qualified staff who know specifically about pancreatitis that we can send them to the medical tent. They can hang out for a minute. The doctors will take care of them, and they can get back to their activities. If they were at school or another camp, these poor kids would have to go home or even go to the emergency room. So this is their first chance to honestly be a kid and meet other kids like them. And because of our amazing medical professionals and teammates that we have across the country, we're able to make this happen. So it's just one of those pieces where kids say, I finally met someone else like me. And those doctors really, they volunteer their time. So it's an amazing opportunity to see our mission in action for that week at camp. The final piece that I will share that our medical professionals are intricate and things that we do every day, but is in our advocacy efforts. Often we have Zoom calls in certain districts that usually includes a doctor and a patient or a parent advocate and a staff member calling in. We lobby for pancreatic listed in government funding because it's separate. NPF is the only organization that lobbies for pancreatitis to be included. Pancreatic cancer, we still lobby for, but there are other partner organizations that help lobby for that. There are also other elements like access to care that we work with and create just that general education. So our doctor's voice and their professional voice is very important as we partner with these agencies. And again, if you can see, a child and their mom speaking with one of the doctors about why they need care and better access to care, it really is quite moving. So it's wonderful to have them share that medical side when we are doing our advocacy work. Those are, again, a little bit about the National Pancreas Foundation. I truly appreciate this time and this opportunity. We're very much a multifaceted organization serving our community, but we work very closely with our community volunteers as well as our medical volunteers, just because it's such a small community of patients, as well as a very tight-knit organization of professionals. And our goal is to continue, again, to move that care and quality of treatment forward for better diagnosis and access to care. So I want to thank you all for your time. But also, if you'd like to follow us on social media, we post all of our webinars and activities online as well. Oh, I can't hear you, Reggie. You're muted still.
Wonderful presentation. Do we have any questions for Jenny?
I do, Jenny. First of all, yes, I agree with Reggie. Very nice presentation. I learned a lot in regards to the pancreas. Of course, having involvement myself at one point. But question I was asking is there a reason or is it genetics why it's more prevalent in the African American race?
That is one of the things we're actually having research on. there are different genetic markers that we're finding. Some of them are related to the CFTR, and one of them, which is the HSEP, I believe. Part of it is why we're looking at clinical studies, actually in Chicago, if it's just delayed access to care or disparities in healthcare access, or if it really is more genetic. So those are one of the things we're trying to address, people understanding their history, as well as, just the general science, and also at the same time mapping if it's genetics and disparities in care.
Thank you for that.
That's a great question.
I've got plenty of questions if nobody else does. I'm Jenny, that was fantastic. I can't believe, I mean, I looked you up on, looked up the organization on the IRS website to see how large you are. And I thought it was missing a zero because you guys are doing an awful lot of work. I'm amazed at how you were able to create this network of providers. I mean, we do have a problem as the Autoimmune Registry. We're trying to hit so many diseases. And so there is no such thing as an autoimmune disease doctor. There's rheumatologists, but they miss a lot. There's all kinds of stuff. They don't have the gastroenterology. They don't have dermatology, which is a huge area, or even neurology. So I guess having that focus is great. But how did you get that network started? And I know that you're how long have you been with the organization?
Almost a year.
Okay.
But I think one of the things that really has been amazing for the NPF is our founders, Jane Holt and Petter Biersick, were very involved and very much involved in their medical community, the original East Coast. So in Pittsburgh, Boston, Yale, Harvard, we have a lot of doctors involved from that network. And the force of those two women to grow really helped establish us within the medical community, I feel, before we became more public facing. Jane suffers from pancreatitis, and Patter lost her sister-in-law very quickly to pancreatic cancer. So I feel their establishment and their foresight to see establishing relationships with hospital institutions, because there's so much of a vast gap between care and diagnosis. They were able to see that and establish, we have to get the doctors on board and get them to make this a priority in their clinics and in their care, which is why the Fellow Symposium has been along for so long. We really are focusing on our medical partners to keep moving that needle.
What's I mean, I can see that that's kind of where they started. So they started in the medical community. So I was wondering how you got CME accredited with that stuff, but now that becomes a little clearer. Well, I know, here's one question. How much of it is driven by cancer? Because I know that cancer inspires fear in a way that other diseases like autoimmune disease don't.
Honestly, cancer is probably one of our smaller, we still do a large amount of education based on it, but most of the folks that come to us is because they're pancreatitis, because there's not another home for them. Often pancreatitis is now a precursor to pancreatic cancer, depending on which studies you're looking at. So we are seeing a path, if you will, in the disease state. So we do work quite a bit with cancer because we have such great centers of excellence and doctors. But a lot of our families, especially with pediatrics growing at the rate it is, and better diagnosis, or earlier diagnosis for treatment, we do have a large base of pancreatic or pancreatitis. Granted, there's not as much funding there, if you will. So that's why we are very grassroots, and why you did not miss a dollar on our IRS 990 form. We are very grassroots organization. But also, if you listen to some of our patients, and probably like many on this call, the path to diagnosis was often very frustrating and very physically painful. And, a lot of skepticism along the way. And then you're now in a chronic disease state, which has, mental health issues, financial issues, and a whole slew of things. So if we can make that diagnosis and education easier for the patient by educating our doctors and physicians, that's really where we're trying to help our pancreatitis folks.
Before I keep going, anyone else with questions? Another question I have is, how could we replicate this for other diseases? I'm thinking of trying to create some kind of, template or, template or set of templates for creating these networks. Do you think that would be possible?
There are other organizations that do have centers or care center relationships. I come from the Cystic Fibrosis Foundation, and so they definitely have care centers that they've created and worked with. PKD also has a Center of Excellence accreditation, so I do know that there are different models. I think the goal is there a structure that is financially feasibly replicable if you're looking for the medical staff? That's where we run into some of the issues with our centers of excellence. If you're looking just for that designation, because if they can't have a social worker, that's mental health is a large part of things. So you have to decide what your priority is. And if you're looking for just doctors or physicians that have established themselves as specialists in that area, are you looking for that specialist to be replicated, or are you looking for that module or that build to be replicated? So I think there's different models you can look at, but I think the ultimate goal would be what the long-term, we share resources, we have speakers, we can refer people to these centers if they're in a rural community and they need the closest center of excellence. Okay, you can go to St. Louis and go to Washio and they'll take care of you. Or if you're cancer, you need to go to St. Luke's. So there's a different listing based on care and access.
Do you go to professional meetings? It seems like you do. The doctors' professional meetings, is that where you're engaging with the provider community?
Yes, so we attend several national meetings that are usually digestive disease related. There's a few pancreatologists, different groups across the country that we attend. And then many of our centers of excellence doctors are usually board members or chairs of those organizations too. So that creates a better connection.
Wow. Let's see. I was taking notes. Let me see if I have any other questions. Yeah, I was wondering how long it took to develop the CME portion of the program.
The CME, we work with a third-party provider who does CME credits. So our main thing was, so we paid them through a sponsorship, but basically it was us getting with our doctors on our education committee or our board and deciding who was speaking on what, and then depending on if it's for a nutritionist or or for a nurse practitioner, those have different requirements that we can check off with the CME company. Like there's different times, like one has to be 90 minutes, one has to be at least 60 minutes. So we use their resources as the subject matter experts, but we provided all the speakers and content.
How much did that cost? Do you have any idea?
There's a couple of different vendors. You can find it from $7,000 to $15,000. It kind of depends though on what you're looking at or how long or how many credits you're doing. Because we do our fellow symposium is also a CME, but that's in person, so you have to be present, and there's different requirements for in person.
So I'm thinking that, the kind of thing that would be appropriate for us to pursue would be something like, some kind of CME related to differential diagnosis of autoimmune disease, because that's a big problem for people with autoimmune disease is getting a diagnosis is a starting point, but getting the right diagnosis is also important because a lot of these diseases have very similar symptoms, and it often takes a while before the correct diagnosis is finally made.
Likewise.
Is that one of the modules in your CME program? Something like that?
It's not necessarily a module, but it's something we've discussed because obviously if you're at a center of excellence, your doctors are already very well aware. So our thoughts are, how do we create emergency room doctors? Because if you're having an exacerbation, you're going to go to the emergency room. So how can we treat them? You don't always have to treat it with painkillers. There's different ways or different things to identify. So our next challenge, if you will, is how to educate or make it a general education for emergency room or rural hospitals that don't have the center doctors who know the people, they know the symptoms, and they're not our target audience for that type of education, if that makes sense.
Yeah. How long has the program been in existence?
The Center of Excellence program, I want to say, is around 7 years old because they're rolling into a very large renewal year in their 3-year terms.
Renewal from what perspective?
So every
Who's-
3 years, they have to resubmit their application. So we have to verify that they still have staff on hand that meets the criteria and that they have participated in a continuing education or some elements, or they've been sharing information and partnering with NPF.
So what's their, what do they get from it? I guess I'm, in my experience, trying to get academic medical centers to work with us has been like pulling teeth. Trying to impose requirements on them seems inconceivable to me, but
It's not, yeah. So there's no financial commitment at this point. It's participation for the most part. And so we provide them with our cookbook just came out. So they'll get X number of cookbooks. They're included in our speaking engagements. They get all the tools and resources. But additionally, we do give them a plaque, and a lot of them use it as a promotional opportunity. So if they're getting to use our name as a nationally recognized organization, we're also working with them to use their doctors to speak. So it really is very much a partnership. And we ask them to participate as speakers and in different areas. And that's one of the requirements. They do need to contribute educationally to one of our MPF platforms in their renewal cycle.
and they renew they all renew in the same cycle? So it's every 3 years?
No, it's a rotation, but
Okay.
your application's up in 3 years.
Okay. Again, opening it up to other questions. Tony, you look like you have a question.
No, hi, sorry I was late. I've been busy.
No problem.
Something out, typing some notes. It's jolly good, fantastic, amazing
Thank
work.
you. We appreciate the opportunity to share with you. And if there's anything we can collaborate, we definitely want to share or get awareness out as much as possible. So we'd love to partner if it makes sense.
I
I would like to know if you have any chapters here in Houston, Texas. I would like to partner with you. I am the co-president for the AIP BIPOC organization, where we focus on a dual approach as well, which is awareness, inclusion, and prevention, and also the autoimmune protocol. So that is, I'm not sure if you've heard of that, but that is a holistic diet that is recommended for people with autoimmune diseases. And so I would love to network with you. We have our signature event, which is called Rock the Block. And we have vendors that come out and speak about nutrition, but also, of course, you could set up a table for, like, autoimmune disease or whatever you would like to bring awareness to. So I just wanted to know, I didn't know if you were in Houston or if you had anyone out here that could possibly attend the event to bring more awareness to this cause. So I thoroughly enjoyed your presentation today, especially the highlight for people of color. I think we a lot of times get minimized and overlooked. And so that was eye-opening for me to hear that we are once again at the highest mortality rate, unfortunately. And then especially with our community being very prevalent in the diabetes world. So yeah, I would love to network with you. I don't want to be rambling, but I do have other networks that I think would benefit both of us. So, but I just wanted to put that one out there first, due to the diet that you spoke about earlier and all of that. So
Perfect. So I'm on our website if you can still see my screen.
Yeah.
And so you can search for chapters. So in Texas, we have a chapter in Dallas and in Austin, but I do believe we have a center of excellence in Houston. So I can do a search, and if there's a doctor there, they may be able to share resources or send someone to the community to participate in.
that would be awesome. Thank you so much.
Oh, perfect. Perfect. Thank you.
Any other questions? Well, I know that I'm going to be in touch with you. I think we're going to be trying to
Thank
figure
you.
out how we can use what you've done to help other organizations, including those on this call and the ones that will be looking at the webinar after it's posted on our website. So thank you very much. This has been fantastic, and I'll hand it back to Reggie.
Yes, a very wonderful presentation, Jenny. Learned a lot about pancreatitis and the impact that your organization is doing. Also like to give the invitation for next month's presentation. We'll be having the executive director of the Rare Disease Diversity Coalition, Jennifer Waldrop. She's a rare disease leader and has made a lot of great impact in that space. So we're lucky to have her present for next month. So again, thank you for attending our presentation. Looking forward to seeing everyone next month. Have a wonderful day.
Thanks, Reggie.
Thank you, everybody.